The risk of developing high blood pressure increases with age. Here are 12 research-backed approaches that can help you manage your blood pressure naturally. But do not be ashamed to take medication if the natural ways do not work. High blood pressure is the major cause of heart attack, stroke, and heart failure. It can also lead to kidney disease, eye damage, and other health complications. We need to look at this from a holistic perspective. Reducing blood pressure, but increasing bad or LDL cholesterol or blood sugar, does not help the overall health objective. This video focuses on reducing blood pressure without causing harm in other ways. Make sure your healthcare team understand the current recommendations for high blood pressure, according to the American College of Cardiology, ACC, and the American Heart Association, AHA. Normal is under 120 by 80. Above that, up to 129 by 80 is elevated or too high. Stage 1 hypertension is defined as 130 by 80 and above. Number 1. The dietary approaches to stop hypertension, known as the DASH diet, has shown remarkable results in lowering blood pressure. Following the DASH diet reduced systolic blood pressure by 3.2 mm of mercury and diastolic blood pressure by 2.5 mm of mercury compared to control diets. This eating plan focuses on fruits, vegetables, whole grains, lean proteins, and low-fat dairy while limiting saturated fats and sugars. However, I would reduce whole grains like rice and wheat-based products, as they contain mostly carbohydrates. I would replace them with legumes. Legumes can help reduce blood pressure. Several large studies have found that people who eat more legumes, such as beans, lentils, peas, and soybeans, tend to have a lower risk of developing high blood pressure. One study in the UK followed over 7,500 people for nearly 4 years. It found that those who ate about 55 to 70 grams of legumes per day had a 43% lower risk of developing hypertension compared to those who ate very little. For women, the risk dropped by as much as 68%. The study suggests that eating at least a cup of legumes daily may be especially helpful for blood pressure. Another study in China followed more than 8,700 adults and found similar results. People who ate the most legumes had up to a 44% lower chance of developing high blood pressure compared to those who ate the least. The benefit was especially strong for soybeans and fresh legumes, but not as clear for non-soybean dried legumes. Legumes are rich in fiber, plant protein, potassium, magnesium, and special plant compounds called polyphenols. These nutrients work together to help relax blood vessels, lower inflammation, and support healthy blood pressure. Some compounds in legumes even help your body make more nitric oxide, which widens blood vessels and lowers blood pressure. Eating more legumes as part of a balanced diet, especially at least 55 grams or about a cup per day, works to lower your risk of high blood pressure. This effect is seen in both men and women, though it may be even stronger in women. Regularly including beans, lentils, peas, and soy foods in your meals is a simple, natural way to help keep your blood pressure healthy. I would also check the carbohydrate content of fruits, as they can increase your blood sugar. So, take them in moderation. Blood pressure is a part of metabolic syndrome. There is no strong research showing that lean meat by itself, without other healthy foods, directly lowers blood pressure. Most studies that report a blood pressure lowering effect from lean meat have tested it as part of an overall heart-healthy diet. I would not be taking lean meat such as chicken more than once a week. In a research, 35 healthy subjects of BMI more than 27 who consumed low-fat dairy products, like low-fat milk and low-fat yogurt, found they have reduced blood pressure. The DASH diet works best when you eat 3 to 4 servings of fruits, 4 to 5 servings of low-carbohydrate vegetables, and 2 to 3 servings of low-fat dairy products daily. Leafy greens help your blood vessels relax and reduce blood pressure. Avoid deep-fried foods, even if they are vegetables. Take healthy nuts like peanuts and almonds in moderation. This approach provides essential nutrients like potassium, calcium, and magnesium that help regulate blood pressure. But many people find it challenging to make such dramatic dietary changes all at once, so consider implementing this diet gradually for better long-term adherence. Number 2. If your sodium intake is high, reducing it can significantly lower blood pressure. There is an approximately linear relationship between sodium reduction and blood pressure decrease. When you consume less salt, your body retains less water, reducing the pressure on your blood vessel walls. But if you are not taking regular pre-prepared foods, your sodium level may already be reasonable. Low sodium, also known as hyponatremia, can cause a range of symptoms, from mild to severe. Mild symptoms can include fatigue, nausea, and headache, while severe symptoms can involve confusion, seizures, and even coma. I had a coma while driving and had an almost fatal accident last year due to low sodium levels. Most health organizations recommend limiting sodium to 2,300 mg per day, with an ideal target of 1,500 mg for those with hypertension. The average person consumes about 3,400 mg daily, mostly from processed foods. To reduce sodium, cook more meals at home, read food labels carefully, use herbs and spices instead of salt for flavoring, and rinse canned foods before eating. But remember that sodium reduction works best when combined with other dietary improvements like increasing potassium intake. Number 3. Potassium helps balance sodium levels in your body and eases tension in blood vessel walls. Increasing daily potassium intake can reduce systolic blood pressure by 4.7 mm of mercury and diastolic blood pressure by 3.5 mm of mercury in all patients, with even greater reductions in those with hypertension. Good sources of potassium include bananas, oranges, potatoes, spinach, tomatoes, avocados, and beans. Increasing potassium excretion from 60 to 100 mmol per day can significantly impact blood pressure. But you should consult your doctor before increasing potassium intake if you have kidney problems or take certain medications, as too much potassium can be harmful in these cases. Number 4. Weight loss is one of the most effective natural ways to lower blood pressure. Overweight individuals with mild hypertension who lost an average of 8.1 kilograms experienced reductions of 4.2 mm of mercury in systolic and 3.3 mm of mercury in diastolic blood pressure. About half of the participants who achieved normal body weight also normalized their blood pressure. For most people, even modest weight loss of 5 to 10% of body weight can make a significant difference. Each kilogram of weight loss can lower blood pressure by approximately 1 mm of mercury. But losing weight sustainably requires long-term lifestyle changes rather than quick fixes, so focus on developing healthy eating and exercise habits you can maintain. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. Number 5. Regular physical activity strengthens your heart, allowing it to pump blood more efficiently. Aerobic exercise reduced systolic blood pressure by 3.84 mm of mercury and diastolic blood pressure by 2.58 mm of mercury on average. These benefits occurred in both hypertensive and normotensive individuals. Aim for at least 150 minutes of moderate aerobic activity per week, such as brisk walking, swimming, cycling, or dancing. You can break this down into 30-minute sessions 5 days a week. The blood pressure benefits begin almost immediately after exercise and can last for hours. But consistency is key, so choose activities you enjoy to maintain a regular exercise routine. Number 6. Weight training and other forms of resistance exercise can also help lower blood pressure. Resistance training reduces systolic blood pressure by approximately 4.1 mm of mercury. At a population level, even a 2 mm of mercury reduction can significantly decrease stroke mortality and heart disease risk. Include resistance training in your exercise routine 2 to 3 times per week, working all major muscle groups. Start with lighter weights and gradually increase intensity as you become stronger. Focus on proper form and controlled movements rather than lifting heavy weights. But remember to breathe normally during exercise, as holding your breath can temporarily raise blood pressure. Number 7. Isometric hand grip exercises involve squeezing a hand grip device and holding the contraction for a period of time. Performing these exercises for 8 to 10 weeks can reduce systolic blood pressure by 8.11 mm of mercury in hypertensive individuals. This makes it one of the most effective exercises specifically for blood pressure reduction. A typical routine involves using a hand grip strengthener for 2 minutes at 30% of your maximum grip strength, resting for 1 to 2 minutes, and repeating 3 to 4 times. Do this 3 to 5 times per week. But ensure you're using the correct technique and appropriate resistance for your fitness level to avoid injury. Number 8. Yoga combines physical postures, breathing exercises, and meditation, all of which can help lower blood pressure. Regular yoga practice can be an effective therapeutic approach for managing hypertension. The combination of gentle movement, controlled breathing, and stress reduction makes yoga particularly beneficial for cardiovascular health. For blood pressure benefits, practice yoga for at least 30 to 60 minutes, 3 to 5 times per week. Focus on gentle styles like Hatha, Iyengar, or restorative yoga rather than more vigorous forms. But always inform your yoga instructor about your blood pressure concerns so they can suggest appropriate modifications for certain poses. Number 9. If you drink alcohol, doing so in moderation can help manage your blood pressure. Excessive alcohol consumption raises blood pressure by affecting the sympathetic nervous system and constricting blood vessels. Limiting intake to no more than 1 drink daily for women and 2 for men can help maintain healthy blood pressure levels. 1 standard drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits. If you currently drink more than the recommended amount, gradually reducing your consumption can lead to significant blood pressure improvements. But if you don't currently drink alcohol, don't start for potential blood pressure benefits, as there are more effective strategies without the associated risks. Number 10. Chronic stress contributes to high blood pressure by triggering your body to release hormones that increase heart rate and constrict blood vessels. Regular stress management practices like meditation, deep breathing exercises, progressive muscle relaxation, or spending time in nature can help lower your blood pressure. Try dedicating 10 to 15 minutes daily to a stress reduction technique. Even simple deep breathing for a few minutes several times throughout the day can make a difference. But understand that stress management is highly individual, so experiment with different techniques to find what works best for you. Number 11. Practice anger management. Anger triggers the body's fight or flight response, causing a surge of hormones like adrenaline and noradrenaline, which lead to an increase in heart rate and blood pressure. This physiological change is a normal reaction to perceived threats or stressors, but prolonged or frequent episodes of anger can have negative health consequences. A good technique you can use is kindness meditation practiced in Buddhism. Number 12. Poor sleep quality and sleep disorders like sleep apnea have been linked to hypertension. Most adults need 7 to 9 hours of quality sleep each night to support overall health, including healthy blood pressure levels. Establish a consistent sleep schedule by going to bed and waking up at the same times each day. Create a relaxing bedtime routine, keep your bedroom cool and dark, limit screen time before bed, and avoid caffeine and alcohol close to bedtime. But if you suspect you have sleep apnea or another sleep disorder, consult your doctor for proper diagnosis and treatment, as these conditions can significantly impact blood pressure. Incorporating even a few of these natural approaches can lead to meaningful reductions in blood pressure. The most effective strategy combines multiple methods tailored to your individual needs and preferences. Do not be ashamed to take medication if the natural ways do not work. Always consult your healthcare provider before making significant lifestyle changes, especially if you're currently taking blood pressure medication. With patience and consistency, these natural approaches can help you achieve and maintain healthier blood pressure levels for life. Do not forget to click the like button and subscribe. On the screen, you see an important video. Thanks very much for watching this video. See you in the next video.